Hello, I'm Dr. Ravindra. I'm the consultant orthopedic surgeon working here at Columbia Hospital, Whitefield. Joint replacement surgery is in fact the last option in the treatment of any degenerative joint pains and aches. In fact, the first initial treatment for these things is treatment of the actual cause itself, if at all we can identify something. So the conservative treatment and the treatment of the initial, the original cause of the problem will usually help the patient to cope for as long as possible. Now, there are pain medications, there is physiotherapy, people can put on a little support like a knee cap or a knee brace to mobilize. Some people do carry a stick, of course, not everybody likes it. To support them to walk around so that they can cope with the pain better. Treatment for degenerative knee problems or hip problems or any osteoarthritis is basically for pain relief. So the patients can manage themselves for as long as possible with these modalities. We tend to encourage them to do so. If they reach a stage where the pain is persistent and it is severely affecting their quality of life, their activity of daily living like walking within the house or caring for their own personal hygiene becomes difficult, or if they start having night pain which disturbs their sleep and routine, that's the time when we advise people to consider a joint replacement surgery.